Hi, this is Dr. Donald Pelto, and I'm so excited to be talking to the New England Amputee Association because you are one of my favorite groups to be involved with. I've spoken to your group a number of times, and I've worked together very close with Rose over the years about educating people that already have amputations, and also educating people on how to prevent amputations. And my little joke for the New England Amputee Association is that you are the most motivated patients that I have, because a lot of you only have one leg, and if you lose the other one, it's going to be a big problem. So I want to give you a few tips today. I may be seeing some of you in my office, but for those of you that I don't see, I want to give you 4 tips, 4 questions that you should be asking your podiatrist. Because we know we all get busy. We go see the doctor and we forget everything that we should say when we go see them. The first question you should ask your podiatrist is, how is my feeling in my feet? Do you have any tingling? Do you have any numbness? Or do you have no feeling at all? If you don't have any feeling in your feet, it can be a problem. And you could even have an infection and not know it. So that's the first question I'd like you to ask your podiatrist. The second one is, how is my blood flow? If you only have one limb, you have to know how the circulation is. Do you have pulses? There's 2 pulses on your feet. There's the first one on the top of the foot called the dorsalis pedis, and the other one at the back of the ankle called the posterior tibial pulse. And can you feel those, or can't you feel those? And if you can't, maybe you need a blood flow study to see what the problem is with your blood flow, or if you have enough blood flow. Now, why do you need blood flow? Because if you ever develop a cut, you need the blood to get down there to heal it. And more importantly, if you develop an infection, you need the antibiotic to get down there. Imagine you have a foot infection, it gets red, hot, swollen, and you're taking a pill by mouth. If you take the pill, it dissolves. How does it reach the foot? It's via your blood, isn't it? And if your blood isn't flowing down there, are you going to get any antibiotic down there? No. Is the infection going to be cleared up? No. So that's why blood flow is so important for people that have diabetes, especially people that have had a wound in the past. The other question I'd like you to ask your doctor, your podiatrist, is if you can get diabetic shoes. Most of the time, your insurance will cover it. Yeah, they want to give you shoes. The reason they want to give you shoes is because if you have the wrong shoe, it could create another problem, another foot wound that's very costly to them. And it's a lot less expensive for them to give you a specialized shoe each and every year. And the last thing I want to tell you, there's really 2 points, but the most important thing is you need to know what you should do if you have a foot problem. Now, this is doubly important for you that have an amputation. If you have a foot problem, a cut, a scrape, some redness, something that you're concerned with, how would you find it out? It's because you're doing the most important thing. You're looking at your feet every single day, at least once a day. If you can't see the bottom of your feet, get a loved one to look at them. If you don't have anyone at home, use a mirror to look at it. And a new technology that I've heard of recently, if you have one of these smartphones, take the phone out, put it on the floor, and put your foot up on top of it and move it around so that you can see how the bottom of your foot is and record it. That's one of the newer technologies, just a quick little tip for you. But if you see something wrong, you should seek medical attention as soon as possible. You as a diabetic and you as an amputee, you're considered what I say a VIP, a very important patient. And you should be seen within 12 hours to 24 hours in the office. Call the doctor. Get a doctor that you can call, that you have a relationship with, that can see you right away. And if you can't, go to the emergency room, because it's definitely emergency. Any problem with your foot is an emergency if you're an amputee. So I'm very excited for the New England Amputee Association, and we're going to be making other educational videos for you, and I hope you enjoy these. Once again, my name is Dr. Donald Pelto. Have a great day.